Welcome, dear viewers, here in our format Natural Medicine. As you know, I'm a big fan of gold implants and have had the opportunity to hear so many experiences from patients in relation to these sensitive implants, for example with arthrosis. Dr. Harald Burgard has often explained and illustrated this to us. So I thought we should test this with my mother because she also had severe knee pain and we wanted to see if this was really true. We'll take you with us for an interesting experience report. Please stay tuned. After the intro we'll start. Here we are again, and now I can show you who's here. On the one hand, the doctor himself, Dr. Harald Burgard.
Welcome, Alexander.
Thank you. And of course my mother, Franziska Glock. Welcome.
Thank you.
And you have the courage to come in front of the camera again.
I'm used to it now.
But it was just a condition.
Yes, it was a condition.
You get an operation, but now let's start with your knee problem. You also lived in Brazil for many years.
Exactly.
And then it started with both knees, didn't it?
Yes, both knees. I had pain. But I didn't have any pain, but it just twisted, the ankle was out, and that was so unpleasant, and I had it done. I didn't have the courage with the second one, because I thought, well, at least I know that I can stand on one leg when I'm operated on, right?
Yes.
And that actually went very well. The operation, he had to do a second one, because on the first one it wasn't quite, it was so wobbly. Then I had a second one, but since then it's really super good. So I don't have anything.
Really? So this artificial knee?
I've had that for 8 years now, and it's still good.
Let me quickly ask Harald, how long does such an artificial knee last?
I think around 10 years, they said, didn't they?
Yes, it depends a bit on when it was done. So you say between 10 and 15 years.
So 15, okay.
Maybe a little longer, yes. There are also sources that say 20 years. Of course, it also depends a bit on the body, on the stress.
Yes.
But around that time, yes.
We walk a lot with the dog, and yes, that's okay. And then I didn't have the courage to do the second one. I couldn't do it. And then I came to Switzerland, and as I said, we heard about it with the gold implants, and I thought I would do that. So I would really do that now.
So you didn't walk the stairs anymore?
Well, it was very difficult when I walked my dog. I just had pain, didn't I? But when I was at home and it really hurt, I said, so lady, let's go for a walk now. And because I'm stubborn, we walked badly, didn't we? So it did hurt, yes. It hurt a lot.
So I only saw you go up and down the stairs. That was really like an old woman. It was really hard.
Yes, that was very bad.
Well, the decision was made. We had an appointment.
Yes, exactly.
Harald arranged everything, so that we could even try it up close.
Yes, exactly. We didn't have to go that far. Exactly.
Before we went there was a conversation first, right?
Yes.
What was it about?
They explained to me what was being done. First, what was wrong, and I had to send an X-ray.
Exactly.
I think it was important that he saw how and what. And then confirmation, yes, with the X-ray, you can do that.
Exactly.
Yes, then it was explained to me, and then we went in there and then we did it.
You were in the operating room. You were on a bed.
I was lying on a bed and it was really disinfected and covered. So like an operation, clean. Exactly. And then it was anesthetized.
I watched it. You have such a big needle.
I didn't watch it, otherwise I would have gotten sick. I didn't feel anything.
I'm not sure how many points it was. 10? 12? It was 19?
No, where the gold came in.
Yes, first the anesthesia.
Yes, exactly, in the same place the anesthesia and then the gold was placed.
In the same hole?
So I first fixed the points and then each single point was anesthetized locally with a thin needle.
You asked if it hurt.
Exactly, exactly. And then after a while I asked again if everything was painless, and afterwards we disinfected everything surgically, put the wipes around it and then placed the gold.
Ja.
Of course, you didn't feel anything.
I didn't feel anything, really nothing.
Es war einfach, ja.
As I said, it was
Wie ich
great.
gesagt habe, es war super. Also ich habe
You could
empfunden,
get up
du
and go
kannst
jogging.
aufstehen und joggen gehen. Es war,
I didn't feel
ich habe
anything.
nichts gespürt.
Yes, of course, there was still the anesthesia.
There was the anesthesia,
Aber ich
but I
bin
didn't
nach
feel
Hause
anything.
gekommen, ich habe auch nichts gespürt. Gar nichts gespürt.
The only
Das
thing I
Einzige,
noticed
was mir
very
dann
positively
sehr
when I was
positiv
sleeping and put my
aufgefallen
feet like
ist, ich
this,
habe dir
I couldn't do it
erzählt,
straight
ich habe
anymore.
ja, wenn
It
ich
was very
geschlafen
painful,
habe und
really, or when they
die
were
Füße
stretched out,
einge-
it was so
ich konnte
painful.
es fast nicht mehr gerade machen. Also es war sehr schmerzhaft, wirklich. Oder wenn es ausgestreckt waren und wieder, das war so schmerzhaft. Und das war in der
I
ersten
didn't have
Nacht
that
habe ich
anymore
schon
with the
immer
first
gehabt.
night. That was
Das
really
war
in the first
wirklich in
night.
der ersten Nacht.
Yes, and then it went on. Actually,
Ja,
it went
und
on
dann
for a very long time.
ist weiter. Eigentlich noch sehr lange gegangen. Also
I
bei
didn't
mir
have a
war es keine
spontaneous healing,
spontane
only that was
Heilung, nur das
spontaneous,
ist
that was
spontan
really
gewesen. Das
spontaneous.
war
I
wirklich
almost didn't
spontan.
believe
Das
that,
habe ich
but
dann
then I had
fast
a long
nicht
time.
geglaubt.
I think it went on for about
Aber
3
dann
months,
habe
until
ich
I
doch
thought now
lange
it's a
Zeit, ich
little
glaube
better. That was
ungefähr
about
3
3 months,
Monate
and
ist
then it
gegangen,
slowly,
bis ich
slowly,
überhaupt
I think I said
denke,
recently that it wasn't good
jetzt
yet,
ist
but
doch
then
ein
it slowly
bisschen
came, and
besser,
now I
oder?
walk.
Das war schon ungefähr 3 Monate. Und dann ist langsam, ich glaube, ich habe noch vor kurzem gesagt, das ist noch nicht gut. Und dann ist aber langsam gekommen und jetzt, ja, ich laufe jeden Tag
About 10 kilometers
ungefähr
every
10
day, and
Kilometer.
honestly,
Und ehrlich,
Poor dog.
I forgot my knee,
ja,
so it's like
und
with hands and feet,
da,
when you have them, but
ich
you never
vergiss
think
mein
about it.
Knie. Also es ist wie mit Händen und Füßen, wenn du die hast, aber du denkst nie dran. Und das ist jetzt genauso
Exactly
mit den
like with the
Knien. Ich
knee,
hab
I have
die,
them, but
aber
I
ich
don't
denk
think
nicht
about it.
dran, dass ich,
That's how it should be.
ja, also das ist wirklich super.
The
Das
only thing I'm
Einzige,
still
wo
working
ich
on is
noch
the
dran
stairs. I can walk
arbeite,
up and
ist
down the
Treppe.
stairs well, but I don't
Ich
trust the
kann
knee
gut die
yet.
Treppe
It's a matter of the
laufen, rauf
head.
und
I notice
runter,
very
aber ich
clearly when I
traue dem
stand up and
Knie
say
noch
I can
nicht.
do it.
Es ist
That's
eine
not a problem for
Kopfsache.
you. Then I can walk
Ich
down well.
merke
I can
ganz
walk up
fest,
well, without
wenn ich
pain.
oben
But if I
stehe
don't
und
think
ich
about
sage,
it,
ich
then I
schaff
limp,
doch
or I
das,
have to
kein
hold
Problem
myself.
für dich. Dann kann ich gut runterlaufen. Ich kann gut drauflaufen ohne Schmerzen. Aber wenn ich nicht dran denke, dann hinke ich. Weil ich einfach oder ich muss mich halten.
But that's pure. I tested it on purpose because I knew you were coming, and then I thought, why do I have this? And that's really a matter of the head. I still have to learn to trust the knee. That's just not there yet.
Und das ist wirklich eine reine Kopfsache. Das muss ich noch, das Vertrauen lernen zum Knie. Das ist einfach noch nicht da, oder?
I also think it's good when someone walks down and holds on. You're not 20 anymore. Just keep holding. Everything's fine.
Halt dich nur weiterhin, alles gut.
No, but I don't even need to hold myself that much. But when I hold myself and I don't have it in my head, then it's still that I walk down with one leg. But when I really concentrate, then it's good. It's just a matter of the head, but otherwise it's great.
Aber wenn ich mich wirklich
Ja, weil man es halt so
konzentriere,
gewohnt war dann, ne?
ja, dann ist das gut. Also es ist einfach nur Kopfsache. Aber sonst, also super.
It's crazy, isn't it?
Super.
How many years of pain did you have in your knee?
Sicher 10 Jahre. Ich habe
Yes,
Schmerzen
certainly
gehabt,
10
bevor ich
years.
auf
I
der
already
See
had
bin.
pain before I went to Brazil, or I was there once to straighten my knee. I've had that before, so it's certainly 13 years in Brazil. I would say 15 years I've had pain in my knee.
Also es sind schon sicher 15, 13 Jahre Brasilien, ich würde sagen so 15 Jahre haben mir die Knie schon wehgetan.
And now you have the operation, so around 6 months.
Also rund 6 Monate.
Was that in May? No, it was in July, on July 17th.
Im Juli.
So 6 months later, almost pain-free, you go up and down the stairs. Still a mindset issue, but the pain is gone, you sleep.
Aber die Schmerzen sind weg, du schläfst.
Yes, there is no more problem during the night, because it was really painful when you lie down and you want to stretch.
Wenn du dann so liegst und du willst dann ausstrecken und das tut so weh, also das tut so weh.
Wenn man denkt, 13, 14, 15 Jahre Schmerzen und jetzt ist es weg.
Ja, ja.
Then I just ask myself, why didn't you do it earlier?
I didn't knew it.
I know, but that was the appeal. What would you say to the audience today about knee problems? But it's not just limited to the knee, it's the ankle, the fingers, the shoulders. You have to do that first, definitely.
Du kannst die großen, die kleinen, die Fingergelenke, kannst alles behandeln.
Also ich würde auf jeden Fall auf eine OP einmal vorläufig abraten und zuerst das machen, auf jeden Fall.
And you have to be patient.
Geduld haben.
Be patient, there are some it works faster. For me is a bit longer, but longer is no
Bei
time.
mir hat es halt jetzt ein bisschen länger, aber länger ist eigentlich auch keine Zeit, wo man denkt,
Yes, but that's a normal time. 3 to 6 months. We say 3 to 4 months. People notice that. But we also know that for some people it gets better after 9 months or 1.5 years even, but in general for most people it's 3 to 4 months, but it comes. That's the deciding
Das
factor.
hängt ein bisschen vom Körper ab, ja, aber
Ja.
in aller Regel, die meisten so nach 3, 4 Monaten, aber es kommt. Und das ist das Entscheidende. Auch wenn
If I have a new knee joint, I can't jump around right away. I have to heal it first, then I have to go to the doctor.
Die Therapie und das
The body needs, no matter what you do, a bit of regeneration or healing. That's normal.
Bis er halt regeneriert oder halt etwas einheilt. Ist normal.
Kannst du mir noch ein bisschen
Can you explain a
erklären,
lit why
warum
there
es
is such a
so
big
normal ist,
difference?
die
I had a patient today, your wife for example. She already had painless feet after 24 hours with this evil hallux that she had, and Mr. Moore said after 3 months it got better and the last effect after 12 months was all good, right?
Hallux, was sie da hatte. Und der andere hingegen, der Herr Mohr, sagte auch, nach 3 Monaten ging es besser und die letzte Wirkung nach 12 Monaten war alles gut, oder?
Yes, exactly.
Warum? Das hat ja mit
Why?
dem Milieu zu tun, mit der
That has to do with the environment, with the stress in the body.
That probably also has to do with the effect that your connective tissue cells take the gold and release particles from the gold.
Weil der Effekt ist ja eben der, dass deine Bindegewebszellen dort das Gold nehmen und aus dem Gold Partikel rauslösen.
So the pain, the inflammation, this milieu has to attack the gold and pull ions out of the gold.
Muss das Gold angreifen und Ionen aus dem Gold rausziehen.
Exactly. Gold particles are released. That has been very nicely determined in science, that the macrophages or other cells do this, but they also have to be active. So if someone has a distracted immune system, let's take an example. You have 10 bodyguards and 8 of them knock on the door with some neighbors who annoy you. Then you have 2 more who watch out for you. If there is a big attack now, they are not able to help you. If your 10 bodyguards are capable and they have nothing to do, then there is an attack, then they can react. And here it is similar, the cells still have to be able to attack. If they are in a body that is occupied with other toxins, then only a part of it is there, then it takes longer. For example, if people take cortisone, cortisone suppresses these immune cell reactions, then it also takes much longer. And therefore, the less a person is burdened, the faster it gets. It also works with the others, but it takes a little longer until the effect comes.
Now we talked at the beginning, that one knee that is operated, the durability of this knee is around 10, 15 years. How is it with yours with the gold implant operated by you?
Wie sieht's aus jetzt mit dem operierten von dir mit dem Goldimplantat?
What can you expect there?
Well, you know the gold implantation since 1983 with humans and what my colleagues who did it earlier, I have not been there for so long, have said, that with their patients, with the most, it lasts decades.
Gesagt haben, ist, dass sie bei ihren Patienten, bei den allermeisten gesehen haben, es hält Jahrzehnte. Ja?
You just have to work how it is.
Aber man kann in vielen Fällen mit einer Implantation eine dauerhafte Besserung
One can be in ought.
erzielen.
But you can also, and this is also an essential point, delay an operation. It is a difference if I get an artificial joint very late and only need one, or if I need one at 50 or at the beginning of 60 and then another one afterwards. You cannot install a new knee as often as you like. 2 times it works, 3 times it does not. The goal is always to avoid it 100%, but that never works in medicine. There will certainly be some that have to be reoperated.
How long does the gold last? That means, how long does this gold ion last?
Then I probably has to be reborn twice. There is so much gold in it. It is never used up in this life. You have to imagine, we have about 60 gold pieces in there. That's a lot.
It is also precious.
Precious, yes, exactly. And that's just a lot that is never used up. That's why you do so much so that a large surface is there. The larger the surface, the more can be attacked, the more effective the effect. But that's not a solution that is represented in the gram area. These are molecules and that lasts forever. That will never be used up in your life.
You just said that it is in a very small dose. I know that these were very small pieces, but if she has 19 of them, she may have 1 gram of gold in her knee, right?
Yes, even more.
You see,
Yes, all good. You don't have to declare that in a testamentary way, this 50 Swiss francs.
that's my problem. How will I inherit my knee?
Müsste vielleicht ein kleines Fenster einbauen, dass man das sieht, ne?
Na, aber ich habe eine Frage, wenn ich darf.
How is it when the knee, which has been operated on, also starts to hurt? Does that also work with gold implants?
If the joint is not infected, which is normally never the case, if it starts to hurt, I would always try to calm it down with gold first. That also works in many cases. We always have patients who come and have an implantation but also have a residual pain, and then I put gold to the places that hurt and then it stops, but if it becomes unstable, which also happens sometimes, then I have to replace it. But when complaints occur, you can always try to intervene with gold first. Although there is gold in there, I can do any other type of therapy. Whether physiotherapy, massage, I can inject, I can give medication, I can also operate. That doesn't matter at all because gold doesn't prevent that. But you have a chance to get peace and quiet with relatively little effort.
But what does it mean when it lasts for an average of 10 to 17 years? Does that mean that the mechanics break down, or are they just renewed inflammation processes?
No, it's more of a mechanical problem.
Also in the hip?
That it loosens up somewhere or that, depending on how the person lives, it may also cause wear and tear. These are metals that rub against each other. Sometimes you also see that metals suddenly rise in the body, that chrome is suddenly found in the blood. If this is found in the blood, then it also has to come out. There are various reasons why this happens. Infection is usually not the problem. That is very rare.
Well, you just said how long a knee lasts. I understand if the mechanics really break the shell that it has to be operated again. That's clear. But the pain shouldn't be there. If the artificial knee breaks,
it depends on how the surrounding tissue reacts. If something breaks and the tissue starts to be inflamed, then it hurts. But in every case, an orthopedist has to look at it and decide whether to replace it or leave it.
So it's 1,000 times better to live with your own joint because it doesn't wobble no matter how old you get.
A biological joint is always the best. We can do a lot with technology, but we can't do it one-to-one. It's always better to keep your own joints if possible, than to get an artificial one.
Sometimes it's also this resistance to knowledge of a certain person. I saw a woman who was the same age as you and didn't want to know about an alternative. She said, "I'll get a new hip joint and that's it."
We have a bit of a substitute mentality like in a car. I replace the starter or the carburetor. That works quite well, but in a highly complex organism like that of us humans it also works, but it's not as trivial as we always think. And it's nothing where you say, "I'll get a new knee joint." About 25% of the operations don't work. 10% of the inserted knees are swapped out every year. That's something that doesn't have a 100% success rate as we always think. The patient often thinks, "I'll go to the doctor and he'll get a new joint." It works in many cases, but not in many cases. And it doesn't last forever. You often think you'll keep it for the rest of your life. That's the case for some, but not necessarily for complex joints like the knee.
As we already heard with Mr. Moore, sometimes they just let you stand in the rain after the surgery is done. You have to live with chronic pain and that's it.
The night operation.
Yes, of course, not after the gold implantation. And if you say, we've done everything, that's it. And then you suffer for years, and he managed to get people free of pain with the gold implants.
You can't operate on everything. Nor can you operate on the residual pain. Then everything isn't fine, and if the surgeon doesn't see any possibility, he can't help you.
Dann ist da irgendwas noch alles in Ordnung, was auch immer. Und wenn der Chirurg eben keine Möglichkeit mehr sieht, dann kann dir auch nicht helfen.
I can still work on the gold implantation. And as we've heard, in many cases it works. That's a completely different approach. And what we always notice with the gold implantation, the first thing people notice, they can sleep on their side or they can extend their leg. So trivial things that you don't associate or that annoy you. You can't lay your leg straight, it hurts, you can't sit still. That's pretty much the first thing that gets better.
I was so amazed after the first night. It really was after the first night and I almost didn't believe it.
That fascinates me again and again, that you sometimes have such quick effects.
Yes, so fast, that was the first thing I noticed immediately, and it stayed that way. It stayed.
Ich höre es immer wieder. Ich kann nicht erklären, warum das dann so schnell funktioniert. Aber bei manchen ist es so.
For some it's like that.
Bei manchen ist es so.
For some it's also like that at some point they call and say, my back still hurts, and when I ask, what did we do? We did the hip. Where did it hurt before? Oh, it hurt in the front, but now it hurts in the back. But that's completely different. Then they have a slipped disc or something else, which is then discovered in the examinations. People sometimes mix up the symptoms. You have to differentiate what happened there, because normally, I've never seen it any other way. If the golden implantation works, then it stays like that it gets worse again, except if someone has an injury, an accident, then it can happen, but otherwise it lasts, and when pain occurs, it's often a completely different place that suddenly starts to hurt.
Did you have any follow-up? Voice, Helen, nothing. No. See him for the first time now after the operation. Wasn't needed at all. Wouldn't know why. Me, he called 2 to 3 times and asked how you were doing. Just by the way. But that wasn't necessary. Nothing was really necessary. 2 hours later, out.
Not 2 hours, the operation is not even an hour.
Yes, with all the pre-conversations, Pipapo, 1.5 hours.
But the pure operation, not long.
Let's summarize that again. Harald, we've been talking about knees again and again, that it is also possible with other disabilities to work with golden implants. Can you summarize something for me? Which viewers, with which pain, should have the option of golden implants in their focus?
A golden implantation can always be done when the pain is due to arthrosis or, for example, with the osteoporosis patients, when the vertebrae are fractured or when someone has a disc accident that still hurts after a long time, then you can always use gold. You can do that on the cervical spine, also with cervical migraines, i.e. through cervical vertebrae, arthrosis-induced migraines. You can do that very well. You can do the golden implantation on all joints, on the shoulder, on the spine, as I said, on the hip joints, the knee joints, the ankle joints, also on the smaller joints. There it is a bit more difficult, but it also works there. We also have special possibilities. For treating every joint that has an arthrosis change, it does not work if someone has bone pain due to tumors. We would not even go there. So always look in the X-ray. What does the person have? You also have to set the indication. But if that is the case for a golden implantation, then it is really successful in the vast majority of cases. You don't have to repeat it, that's just one intervention and then it's over.
We have already talked about the fact that the veterinary medicine is already being done for a long time. Do we now have to send our Swiss viewers to the vet? Because I know, the medicine is, we hear that, but it is not yet so widespread.
Yes, well, in our medicine, in Germany, in Europe, also in other countries of the world, we have a certain standard procedure, and that is the joint replacement when all other options are exhausted. That's how we learned it and continue to. The gold implantation is a very small area that has already been shown differently in veterinary medicine. In 1975, a colleague Dirk somewhere in the USA started to develop it, and it has spread enormously, and many veterinarians know that, and many veterinarians also send us patients because they then say to the patient, gentleman or lady, what's going on? Why are you limping? Why don't you have some gold implanted? And then they come to us. But for humans it's something that is still unknown.
Imagine our shepherd dog had severe back problems, if only we knew that.
The hip dysplasia, that's how it started back then. You didn't want to euthanize the animals, you thought about how you can help them and could you implant the hip joint. That didn't exist back then. So someone had the idea with gold, it worked, and then it spread. For people, it's too easy, and that's probably why they don't do it.
Again, the doctors who are watching now, or the many patients who say, my doctor doesn't even know that yet, the patient should actually send this video to their doctor and say, please watch it and learn it. Can he learn that? How long does it have to take? How can the doctor offer that in his region? Because you have this academy, you train the people.
Yes, you can learn it, but you have to learn it in a well-founded way. That means that it takes at least a year, where you have to be accompanied. You also have to learn the individual joint techniques.
So every single operation has to be done, right?
Yes, multiple times. You just have to be able to do it. It's like with everything. I can't say I'm operating your appendix just because I read my book or because I studied medicine. I have to be able to do it. So I have to learn it, I have to be able to do it, I have to repeat it, so that it can also be carried out professionally. But then it works. Of course, it is always the case that the colleagues have an everyday life, a practical everyday life that is organized. And if I do something new now, then I have to reorganize. That means I have to be ready to say, I'll change something, I'll change the speaking hours or whatever, because just going on like this and doing something additional is difficult. I also need an operating room.
But you have to refer the patient to another operation. And now you could say, instead of referring to the operation, I could refer my patient to a colleague who works with gold implants, right?
Yes, of course. That would be the future. We do it that way too. Where patients can be treated locally, we recommend that to a colleague and say, call us. Some say, of course, we really want to come to you only. That exists also, but some also accept the offer. And that is an advantage for everyone.
Great. Do you have anything else to say in conclusion?
No, I'm really happy about it. I did it, really happy about it. And I would really recommend it, in any case. And as I said, my doctor didn't know it either. The Dr. Klein. Yes, she didn't know it either, but she was very interested. And she thought it was great, because she actually wanted me to go to I don't even know what it's called, a self-treatment.
Self-treatment, right?
Yes, something like that.
With platelet-rich plasma, right?
Which she doesn't do herself either, but I didn't want that. I'm just a little weird there, because when I hear that I'm going to therapy for days and weeks and walking sticks, and then it's over.
No, you have to be in such a therapy form, so platelet-rich plasma or other things, that works very well with a first and second degree arthrosis, but as soon as the higher degree is 3 and 4, the effect is limited, very short term. And you have to repeat it over and over again. I once had, because patients came and said, yes, they do pain therapy, they can also treat my knee with a 4th degree arthrosis, then I injected a special, very good hyaluron into it. That didn't last long, and then you go into the joint. Going into the joint always means a higher degree of infection. With the gold implantation you stay out, I don't go into the joint, I put the gold out and around. That means I have far fewer risks and I do one treatment. I do that every 2 months or every 3 months. Maybe the patient has to do that permanently. In short, that was at least as expensive or even more expensive than when I do a gold implantation.
You make sure that this video also reaches Ms. Klein.
Yes, I gave her the address of Mr. Harald, and she was really very busy with it.
Good, great, because that's the goal. We really just want to spread this knowledge via this platform so that others also have the chance to do so.
No, she was really interested in it and immediately researched on the internet. I'm sure she's already familiar with it. I'm also familiar with it. She's also a good doctor, very good. But she really didn't know it.
Great. Thank you very much for having the courage to come in front of the camera for the second time. Great. And if I have something outstanding again, I'll experiment with you again. Great. Thank you.
Thank you.
Franziska Klock and dear Dr. Harald Burgard, thank you for introducing this technology to the world so that we all have the chance to enjoy the benefits of it. Thank you very much. And to you too, dear viewers, I hope you have seen this practical case documentation, this fact check, let's call it modern, and seen from the outside that it actually works and is extremely successful. I am happy that my mother is doing better. And I hope that you will continue to spread this video to numerous doctors or to people who know that they have problems with arthrosis and can give them the courage and hope through this video. All the best. See you next time. And goodbye.